Hello friends, welcome back to Complete Medical Coding. Today let's discuss few guidelines and practice questions from the musculoskeletal series. Musculoskeletal series, it is the musculoskeletal system is the 20,000 series. Alright, so let's discuss few more important questions from the CPC examination, some important questions, okay, or some related questions you can say, and then few guidelines as well. All right, these guidelines I'm mentioning because if you do the questions, then only you can understand in what type of question, what guideline we should use. So that is why I'm not taking again separately the guidelines, because I had taken each and every chapter wise guidelines, each and every chapter wise guidelines with examples in the initial videos. If you can see my starting videos, which was taken almost a year back, there are guidelines. The chapters which I had done, it is actually chapter wise from each and every chapter from the CPT codebook as well as the ICD codebook. Okay, so all those guidelines have mentioned. Those who are new to my channel, this is for you. So you can go through those videos initially, okay, those guidelines. If I am taking a musculoskeletal system, if I am putting a new video based on musculoskeletal system, or if I am putting a new video based on the practice questions from the musculoskeletal, you first go and check my chapter which I had taken before in the starting of my channel. If you can see chapter wise videos, it is mentioned with the chapter name musculoskeletal system, like that. So it is easy for you to identify also. So go through that. So from there you will get so many guidelines, because that is only the guidelines, the chapter based guidelines plus some examples. Okay, so I don't want to repeat it again like that. So that is the reason I am doing practice questions, so that you will be getting knowledge about how you will get the how the questions will be in the CPC examination. Okay, so according to that, and what guidelines should be used. So according to that, you can easily learn and understand the guidelines also. All right. Anyway, let's move to the questions. Okay, moving to the first question. So friends, if you are new to the channel, please subscribe. Please support me. So moving to the first question. A patient had a unilateral percutaneous intradiscal electrothermal annuloplasty on L3-L5 with fluoroscopic guidance for needle placement. How would you report this professional service procedure? Okay. How will you report this professional service procedure? So here the patient is having unilateral percutaneous annuloplasty. The procedure carried out is annuloplasty, electrothermal annuloplasty. Okay, on L3, L5, on L3, L5 disc, this procedure is being carried out. So how will you report? And this is carried out with fluoroscopic guidance. Okay, so how will you report this service? So let's find out the answer. Let's go to the codes one by one. Open your CPT code book, please. And the first code. First option, first code, 22526. What is 22526? Percutaneous intradiscal electrothermal annuloplasty, unilateral or bilateral, including fluoroscopic guidance, single level. Single level. So this is exactly the procedure what is carried out here. Unilateral or bilateral is mentioned in the description. So in our question it is unilateral, so that doesn't matter. So percutaneous intradiscal electrothermal annuloplasty, same. Okay, unilateral or bilateral with fluoroscopic guidance. Yes, ours is also with fluoroscopic guidance. So till that it is correct. And then what is written? Single level. So 22526 is the code for single level. Here, what is our level? The disk level. Single level in the sense the disk, which disk it is carried out. So L3 to L5. So actually L3 to L5 is how many levels from L3 to L5? L3 to L4 is one disk, and then L4 to L5 is another disk, right? So 2 levels it is. So 22526 is the code for a single level. And what is 22527? Below that. So 22527 is one or more additional levels. Yes. So that also you have to code it, right? 22527. Because here there are 2 levels. So one or more additional levels. One or more additional levels. So it could be one or it could be more. So if in the question it is from, for example, L2 to L5. So how many levels will be there? L2 to L5. L2 to L3, L3 to L4 and L4 to L5. 3 levels. So you should not mark it again as 22526, 22527 and 22527. No, that is wrong. Because 22527 is a code which represents one or more additional levels. So even though it is 2 or 3 or 4 or 10, whatever it is, you should code only one time. 22527. Okay. From 2 to 2 or more. Multiple, you can say. So these 2 codes is the one that you need to code. You directly got the 2 codes. Now, if you can see options, the other options. In option B, what is mentioned? 77 is the same code along with an additional code, 77002. Of course, you know 70,000 series is radiology, right? 70,000 series belongs to radiology. So 77002 is something which is related to radiology. In our question, so you can skip checking that out because in our question, what radiology is mentioned, fluoroscopic guidance. But you don't have to code it separately, right? Because in the code 22526, it is already mentioned, the fluoroscopic, with fluoroscopic guidance is the description. So you don't have to go and check what is 77002 because you know that 70,000 series is, or the code that's starting with 77 is from the radiology department, from the radiology section, which is already included in our CPT code 22526. So you can skip directly. You can skip checking that code. Okay, so like that you can save your time in examination. Okay, 77002. That is fluoroscopic guidance only. If you check, you can see the same fluoroscopic guidance. That's why I said no need to go and check it. So you can skip options B, C and D because in all 3 there is fluoroscopic guidance. Radiology codes are mentioned which is not required, which is not needed because it is already included in the CPT code 22526. So like that, within a fraction of second, not even like less than a minute, you can find the answer for this question. Okay, I'm taking this much time in order to explain you how to save time, how to find the correct, appropriate answer, appropriate code. Okay, so actually for this question, you can easily find out the answer in less than a minute. So what is the answer for this question? Option A. Okay, 22526 for the first level, single level, and then 22527 for the additional levels. Okay. Now, moving to the second question. A 52-year-old female has a mass growing on her right flank for several years. It has finally gotten significantly larger and is beginning to bother her. She is brought to the operating room for definitive excision. An incision was made directly overlying the mass. The mass was down into the subcutaneous tissue, and the surgeon encountered a well-encapsulated lipoma approximately 4 centimeters. This was excised primarily bluntly with a few attachments divided with electrocautery. What CPT should be reported? Okay, so here the excision of mass is the procedure. Simply you can say excision of mass, excision of that lump which is growing on her right flank. That is the procedure carried out here. Anyway, let's go and find out the answers. Let's check out the options. First one, 21932. This is also a simple question. You can save time here also. 21932. What is 21932? Excision of tumor, soft tissue of back or flank, subfacial. Example, intramuscular, less than 5 centimeter. Excision of tumor, soft tissue, intramuscular. What is the procedure carried out here? Is it intramuscular? Is it subcutaneous? What it is? Yes, the mass, see, almost in the mid of the question it is mentioned that the mass was down into the subcutaneous tissue. So it is in the subcutaneous tissue. So intramuscular code is wrong. What is 21935? 21935 is radical resection of tumor. Example, sarcoma, soft tissue of back or flank less than 5 centimeter. This is not radical resection, it is excision of tumor only. So that code is also wrong. Now, if you can see the third option, 21931. What is 21931? Excision of tumor, soft tissue of back or flank, subcutaneous 3 centimeter or greater. How much is our size mentioned? Is it mentioned? Yes, 4 centimeter. Lipoma approximately 4 centimeter is mentioned. So yes, this is 3 centimeter or greater. Okay, so 21931 is 3 centimeter or greater. Now, what is option D? 21925. 21925 is the code for biopsy. Biopsy, soft tissue of back or flank, deep. This is not biopsy, this is excision, which is clearly mentioned in the starting. Okay, so 21931 is our correct code. So answer here will be option C, 21931. Excision of tumor, soft tissue of back or flank, subcutaneous, 3 centimeter or greater. Okay. Now moving to the third question. An infant with genu valgum is brought to the operating room to have a bilateral medial distal femur hemiepiphysiodesis done. On each knee, the C-arm was used to localize the growth plate. With the growth plate localized, an incision was made medially on both sides. This was taken down to the fascia. Which was opened. The periosteum was not opened. The orthofix figure of 8 plate was placed and checked with X-ray. We then irrigated and closed the medial fascia with 0 vicryl suture. The skin was closed with 20 vicryl and 30 monocryl. What procedure code should be used? Alright. So here, so many stories have mentioned, but you need to just identify what exactly the procedure carried out. This is not a case study question, okay, but still I'm just telling you, you have to find out how or what procedure is being carried out here. So what procedure is carried out here? Bilateral, it is clearly mentioned in the first line, right? Bilateral, what is that? Bilateral medial distal femur hemiepiphysiodesis. Okay. Hemiphyseal. Hemiepiphyseal, yeah. Hemiepiphysiodesis is the procedure carried out here, which you need to find it out. The rest remaining all are stories. Alright, and this is bilateral. Anyway, you can see in all the options, bilateral code modifier is mentioned, 50 is mentioned. So now you have to find out the answer. Okay, let's start the codes one by one. What's the first one? 27470. First code. First option 27470, which means repair non-union or malunion femur distal to head and neck without graft. Repair. Just it is mentioned repair. Anyway, let's find out the other codes also description. 27475. 27475 second option. 27475 is arrest epiphyseal any method. Example, epiphysiodesis, distal femur. Okay. This is not femur. Here, it is not on the femur, right? It is on each knee. Yeah, genu valgum. The infant is having an infant with genu valgum is mentioned, right? So, what do you mean by genu valgum? See, this is why you need to understand some medical terminologies, some anatomies, at least some medical terminologies, so that you don't have to, like in the question it will be some medical term, and then in the book you might get sometimes the same term, sometimes you will get different. Anyway, what is genu valgum? Genu valgum is known as knock knees. Another name for genu valgum is knock, K-N-O-C-K, knock knees. Okay, so it's a condition where knees touch or are close to each other when standing straight. Like the knees will touch each other. That is what genuvalgum is. Okay, the knees will touch each other when you stand straight. Both the knees will touch together, but the ankles are separate. Ankles will be separate, legs will be separate, but only the knees will be touched every time when you stand straight. So that condition is called as genuvalgum. Okay, so this is something related to the knee. Anyway, 27475 code is something which is same, yeah, epiphyseal, but distal femur is mentioned. What is 27477? Option C, tibia and fibula. The same 27475 arrest epiphyseal any method. 27477 is, instead of distal femur, they have mentioned tibia and fibula proximal. And what about option D, 27485? 27485 is arrest hemiepiphyseal distal femur or proximal tibia or fibula. Example, genu varus or genu valgus. Yes, here you got the correct medical term, genu valgum. It could be the full knee. That is why it is mentioned in the CPT code 27485. Distal femur or proximal tibia or fibula, genu valgum. So genu valgum is the procedure. I mean the condition here. So for that, arrest of hemiepiphyseal, that is called as hemiepiphysiodesis. That is a procedure carried out here. So here the correct answer will be option D, 27485, right? And you have to append it with modifier 50 since it's a bilateral procedure. All right. Hope you understood. Hope you understood what is genu valgum. Okay. Now let's go to the fourth question. Let's move to the fourth question. See, this is a case study question. I'll be taking a separate video regarding case study questions. Still, this is one among that. Anyway, let's read out the question carefully. And then if there is something important, anyway, only CPT code you have to find out. You have to find the answer for the procedure code only. No, there is no diagnosis that you need to find out. So let's go directly to the question. Let's read the question carefully and let's find out what is the exact procedure carried out here. Okay. Pre-operative diagnosis. What is the pre-operative diagnosis? Displaced impacted Colles fracture, left distal radius and ulna. Post-operative diagnosis, again same, displaced impacted Colles fracture, left distal radius and ulna. So this means the pre-operative diagnosis and post-operative diagnosis are the same. If in the question, if they have asked for the diagnosis, what you have to find the diagnosis? You have to mark the diagnosis code. The post-operative diagnosis, which is the confirmed diagnosis. Okay. Anyway, here it is the same as the pre-operative diagnosis. Displaced impacted Colles fracture. That is a diagnosis here. For both left, not both, for left distal radius and ulna. Now, operative procedure. What is the operative procedure here? Reduction with application external fixator, left wrist fracture. Findings. What are the findings? The patient is a 46-year-old right-hand dominant female who fell off stairs 4 to 5 days ago, sustaining an impacted distal radius fracture with possible intra-articular component and an associated ulnar styloid fracture. So this patient, right-handed, that's all just story, okay. Fell off 4 to 5 days ago, sustained an injury, impacted distal radius fracture, okay, with possible intra-articular component and associated ulnar styloid fracture, okay, these two fractures. Now, today in surgery, fracture was reduced anatomically and an external fixator was applied. So, reduction of the fracture, that is the procedure carried out here. Going to carry out, because today in surgery, that is what is mentioned. Today in surgery, fracture was reduced anatomically. So, reduction of the fracture, okay, and external fixation was applied. That is what the procedure carried out. Now, procedure, how the procedure is carried out. In the procedure, it will be all story, but you might get some important points also to mark it out. Okay, so let's read it carefully. The procedure: under satisfactory general anesthesia, the fracture was manipulated and C-arm images were checked. The left upper extremity was prepped and draped in the usual sterile orthopedic fashion. 2 small incisions were made over the second metacarpal, and after removing soft tissues including tendinous structures out of the way, drawing was carried out and blunt-tipped pins were placed for the EBI external fixator. The frame was next placed and the site for the proximal pins was chosen. Small incision was made. Subcutaneous tissues were carried out of the way. The pin guide was placed and 2 holes were drilled and blunt-tipped pins placed. Fixator was assembled. C-arm images were checked. Fracture reduction appeared to be anatomic. Suturing was carried out where needed with 4-0 vicryl interrupted subcutaneous and 4-0 nylon interrupted sutures. Sterile dressings were applied. Vascular supply was noted to be satisfactory. Final frame tightening was carried out. What CPT codes should be reported? So we already checked what is the procedure, right? What was the procedure here? Under the procedure, it is all the story. I mean, how the procedure is carried out. Okay, so there is nothing important to be mentioned, but what is the actual procedure carried out here? 2 procedures were carried out: reduction of fracture and then external fixation. Okay. Let's go directly to the options. First option, 25600, the first code, 25600. Please go and take 25600. What is 25600? Closed treatment of distal radial fracture, example Collis or Smith type or epiphyseal separation, includes closed treatment of fracture of ulnar styloid when performed without manipulation. Okay. So now, but in our procedure, if you can see the starting of the procedure, that is why even though it is history, there will be something that you will get from the history mentioned, the story mentioned. Procedure. What is the beginning? First sentence under procedure. Under satisfactory general anesthesia, so it means general anesthesia is carried out. Okay. The fracture was manipulated. So it means the procedure is done with manipulation. So the code should be with manipulation. So which means the code 25600 is the incorrect code, because in that code it is mentioned the description as without manipulation. So that is the wrong code. So option A, you can skip it out. Move to option B now. Option B, 25605. Yes, with manipulation. So 25605 is the code that represents with manipulation. Let it be there. If we can see options C and D, again, see 25606 and 25607. Let's find out what it is. 25606 or 25607. 25606 is percutaneous skeletal fixation of distal radial fracture or epiphyseal separation. No, this is not a percutaneous skeletal fixation, right? This is closed treatment. Closed treatment. Yeah, what was mentioned here? Reduction. Yeah, reduction of the fracture was, today in surgery, the fracture was reduced anatomically. The fracture was reduced anatomically. So it means it's a closed treatment. It's not an open treatment. It's not a percutaneous treatment. That is why that term is mentioned. Okay. In surgery, fracture was reduced anatomically and external fixator was applied. So this is a closed treatment. So percutaneous fixation option is wrong. What is 25607? Open treatment. 25607 code is open treatment of distal radial extraarticular fracture or epiphyseal separation with internal fixation. That's also wrong, because this is not an open treatment. Since the fracture was reduced anatomically, it means it is a closed treatment. So you got the correct CPT code as 25605. And also you got the correct answer as option B, because 25605 is only in option B. So of course that will be the answer. You have to append it with the modifier LT to show that it's a left distal radius fracture. And what is the other code? The second code 20690. Of course it will be the code for the external fixation, right? You don't have to check it out. Still for now I will just read out what it is. But you can directly mark the answer as option B. 20690. 20690 is application of a uniplane unilateral external fixation system. Yeah, same. Append it with the modifier 51 to show that this is a multiple procedure. That you know, right? Because it's a multiple procedure. Two different procedures for the same anatomical site. Okay. So, as I told you, the answer here is option B. Alright, friends. You should take hardly 3 to 4 minutes for such type of case study questions. Case study questions, of course, you need more time, or at least maximum of 5 minutes you can take. Okay. Especially if in the options, if it is without ICD code. If it is with the ICD code, you might take 2 or 3 minutes extra. That is not an issue. Anyway, let's move to fifth question. Fifth question. This is a 32-year-old female who presents today with sacroiliitis. On the physical exam, there was pain on palpation of the left sacroiliac joint, and imaging confirmation was done for the needle positioning. Then 80 mg of dipomedrol and 1 ml of bupivacaine at 0.5% was injected into the left sacroiliac joint with a 22 gauge needle. The patient was able to walk from the exam room without difficulty. Follow-up will be as needed. The correct CPT code is. So here, what is the procedure carried out? The patient is having sacroiliitis. So if there is any diagnosis, if there is any ICD code that you have to find out, you can directly mark it as sacroiliitis. Okay. So palpation, there was on examination there was pain on palpation of the left sacroiliac joint, and imaging confirmation was done for the needle positioning. Yeah. So palpation of left sacroiliac joint, and then imaging guidance is also there. Anyway, let's go and directly find out the answer. Discuss the codes. What's the first one? 20610. What is the code for 20610? The description. 20610 is arthrocentesis, aspiration and injection, major joint or bursa without ultrasound guidance. So 20610 is the code for arthrocentesis. Of course, this is not an arthrocentesis procedure. Okay. What is 20551? The second option, 20551. Injection. 20551 is injection, single tendon, origin or insertion. Okay. Option C, 27096. And option D, 20555. Let's see what is 20555 because it's on the same page. So I will just check that also. 20555 is placement of needles or catheters into muscle and soft tissue for subsequent interstitial radioelement application. What is option C? 27096. 27096. 27096 is injection procedure for sacroiliac joint, anesthetic or steroid with imaging guidance, fluoroscopy or CT. Anything could be, okay, including arthrography when performed. Yes, this is the procedure carried out here. Okay, so see, why is this mentioned as injection? It is mentioned in the question, the second sentence. On the physical exam, there was pain on palpation of left sacroiliac joint and imaging confirmation was done for the needle positioning. It means for the injection. For the injection, palpation of left sacroiliac joint and imaging confirmation was done. So, injection procedures for sacroiliac joint is the procedure here, which is only in option C in the code 27096. Okay, so injection procedure for sacroiliac joint. It could be anesthetic or steroid, whatever it is, and with image guidance. So imaging guidance, it could be fluoroscopy or CT, whatever it is. In the question, you might get, instead of now it is mentioned as fluoroscopy. What is mentioned? Imaging information only mentioned. Sometimes a CT scan was done, something like that it could be mentioned. Still, you should not code separately for CT scan, because in the description of the code 27096, the imaging guidance is also present. Okay. So, you should not code the imaging, the radiography code separately. So, 27096 is the exact code that we need. You should append it with the modifier LT. Okay, left, because it's a left sacroiliac joint. So, the answer here is option C, 27096 with modifier LT. Alright, hope you understood. If you have any queries, please mark me in the comments. So thank you so much, friends. That's it for today. Hope you like this video. If you find this video useful, please like and share it among your friends, especially for those who are preparing for the CPC examination. Okay. And as I told you earlier, before doing practice questions from this video, please go and check the guidelines which I had taken in the initial section, in the starting of my channel. You can go to my older videos. You will get chapter wise guidelines. Okay, starting from intercommentary, you will get everything, even from the basics, everything you will be getting. So thank you so much, friends. That's it for today. If you are new to the channel, please support me by subscribing to the channel, and thank you so much. Stay tuned for more videos and see you in the next episode. Bye. Take care. See you soon.